Hi there. My name is Ian McPherson, and I am hoping that we won't have any further hiccups. Technology is not my strong point, but I've had a great support from my colleague Joe at Cardiomyopathy UK. What we're looking at, I'm sorry, it's still very dark. I'm just going to see if I can do something with the lighting. Hi there. It's still a bit dark, but I think that is probably, given my appearance, not a bad thing. I know you are getting a shine off the top of my head, which is the norm. Many thanks for dialing into this, and I'm really pleased that you're getting the opportunity to help us explore the importance of the emotional impact of living with cardiomyopathy at the time of COVID. It's a big issue, and it's one that I'm very grateful that a number of you have sent in questions, which I think will be representative of the sort of questions that many colleagues, people with cardiomyopathy, will want to ask. A little bit about myself, just to explain who I am. I am a trustee with Cardiomyopathy UK, and I joined specifically because I found that cardiomyopathy, which I had been referred to when I had my diagnosis in 2011, I've got hypertrophic cardiomyopathy. What we found was that the emotional impact of the condition was a big issue for the trust and for the organization. And since then, I've been working with colleagues, fellow trustees, board members, our clinical advisory group, and obviously the staff to look at what we can do to try and improve the quality of the experience. It's a difficult thing to do because what we found in a survey we did in 2016, that although the vast majority of people who had a diagnosis of cardiomyopathy and their families acknowledged that it had a major impact, almost 90% of people said that it's not something that is routinely looked at in cardiomyopathy clinics. And we're hoping that we will change that. But we've also focused on improving the range of things we already did, which a lot of which already devoted quite a lot of time to supporting people in terms of the emotional impact. And that's our support groups, the on-call, the chat, the nurse support. And we've started a number of additional things which are being run at the moment, and you will see opportunities to participate in those. And I hope you will take them up. But let's move on to the questions. Sorry, I'm just going to have to rearrange myself again. I don't have a studio like we do in television. So we can look at that. And I'm pulling up the questions. What I would say is I'm a retired clinical psychologist, but I'm actually drawing off my experience of being a trustee and talking with people with cardiomyopathy. And I've had some fantastic feedback from people from support groups, from national events. And a lot of this is about getting down to how it affects us. So I'm talking about me as well. But let's start looking at some of the questions. The first question we've had is from Sue. And Sue says, I've never been an anxious person, and I'm generally very positive. Since the coronavirus lockdown, I found myself feeling more and more worried, not just about my cardiomyopathy, but going out again after all this is over. Do you think this is normal? I can't sleep for worry lately. Well, Sue, I think what you're saying, it will resonate with many people who are looking at this. And I think what we'll find is that lots of people have actually very similar concerns. I think we need to put this in context. We are actually in the middle of a pandemic. There has not been a pandemic in this country since 1918. So none of us have lived through a pandemic. None of us never really knew what a pandemic was. And I think the impact that that has had in the last 6-7 weeks has been huge. We're deluged on television daily with negative feedback about what's happening. We hear all about the numbers of people who very sadly have died. We don't hear about the people who've had the coronavirus and have actually coped well and have recovered, even some of whom have been very seriously ill. So in practical terms, I think it's important that we don't beat ourselves up for getting anxious about it, but at the same time, we try and contextualize it. There are many things that we are unable to do at the moment that we would normally do, which would make this better. So the sort of social contacts that most of us are able to have, the structure that comes from being able to go out to work, if you go out to work, or do the other things you normally do, has been lost to us. It's also not been helpful that we got some mixed messages from the government when they were describing what the conditions were, and they've got 3 levels of condition, one of which is where you need to shield. And I think when that first came out, there was some confusion, and you will have seen this on the Facebook page of whether cardiomyopathy came into that, and that was where you really had to keep away from people as much as you could and more or less be isolated. Now, that is not the case for the vast majority of us with cardiomyopathy. It is the case for some, particularly people who have autoimmune disorders or have had a transplant. But the majority of us can do the second bit, which is social isolation. Now, social isolation, however, is really difficult because we spend a lot of our life connecting with people. And although that's not always perfect, it does give us a lot of feedback, a sense of where we are in the world. And even the things that may occasionally be difficult can actually make our lives so much better. So I think we need to remind ourselves of that. I think also that we have to bear in mind that if we'd been told 6 weeks ago that we would have to go into social isolation for 6 weeks, I think most of us would have said, I can't handle that. That would be far too difficult. But we have done in the main, even though quite a lot of people like you and others are experiencing problems. You mentioned sleep, and sleep is something that is important. One of the things we're hoping to out of here is identify the common themes that come up, and sleep is one of those. People are not sleeping as well, and there's some good guides to sleeping and improving our well-being generally, which we will be looking to add to the kind of a virus list that is already on the website. I won't try to go into all of these tonight, but we will be able to show these in due course and share these with you. So thanks very much for raising this. It is normal to feel distress. It is very uncomfortable to feel the level of anxiety that I think you're experiencing. And I think some of the things that we can do to help our well-being at this time will benefit you and many others. And a lot of that is to be able to talk about how we're feeling, not with everybody, but with people who we feel are sympathetic or empathetic to how we're feeling. And that to me is something that this is part of the process. So you've contributed to that by raising that issue for us tonight. The next one we've had is from Kevin. Kevin says, I have depression and I've been on antidepressants for years. I've been self-isolating at home. I live alone and I'm starting to feel even more low in mood and just want to sleep or do nothing. Do you think I should ask the GP to increase my medication? Well, I think a lot of people benefit from medication, and if you're on medication and you're not feeling so good, I think it's a perfectly reasonable thing to talk to your GP about this. But it may also be that there are other things you could think about doing that might be beneficial. One of the difficulties of depression is it does make doing anything seem pretty impossible. And I hope that there will be sufficient energy, because if we lose the structure of our day, if we're not able to do things, if we're not meeting people, and it's about restructuring our day to try and build that in, and that can be hard. I mean, if you're depressed, even getting out of bed is very difficult. But if you can build that in and build in a structure that is actually includes things that you enjoy doing, things that make a difference, that might be music, it might be watching films, it might be just going out for that hour's walk, but concentrating on other stuff. There are other things, however, that might benefit you. And again, these are covered in some detail in the various guides to how to improve your well-being during the point of COVID. And one of these is thinking about mindfulness. Mindfulness is, I'm not going to try and do it with you here, but it is something whereby you can actually understand, get to focus, stop your mind racing. This is very good for anxiety too, obviously, and just focus on your thoughts, but slightly stepping back from them. And it's a technique, and there's lots of guides to it. There's lots of online things. There's apps. There are audio tapes where you can be taught through it. And it's not for everybody, and nothing's for everybody. We all need different things. We are all different people. But I think it's important that we manage to do this. And I think if we can try different things, and when you're depressed, you don't feel like doing it. I mean, it's really hard to get motivated. The other thing that you and many others might want to consider if you're feeling really down is, would you benefit maybe from accessing talking therapies? Talking therapies are available, and it's different in different countries. So I'll talk about the one I know. It's England, but there are different arrangements I know in Scotland and Wales, and we'll try and put up, I've got the 4 guides to well-being for the 4 different principalities. And if I just talk about the one I know a little bit about, which is England, and then we'll be able to get the other stuff off those. I think we all benefit, and I've certainly benefited because I've experienced depression all my life. And I have benefited both from medication and from having access to talking therapies at different points. What that is, and it will be different for different people, but it's an opportunity to sit and reflect with a trained person, a counsellor, or somebody with counselling skills, what it feels like and why we're feeling as we are, and maybe to reflect on things we could do. They use different ways of doing it. There's something called cognitive behavior therapy, which is quite commonly used, but there are other approaches also used. So what I would say to you is think about whether you would like to access. Now, the important point here is that these are available at this time. They're available mainly online for obvious reasons at the moment. And that will be okay for some of us and not okay for others, but it's a choice. And if you want to find out, if you put the IAPT, which stands for Improving Access to Psychological Therapies, in your search engine, and then add in another, just your area or your postcode, it should come up with your local services. Services are provided by the NHS. They're also provided by a number of voluntary sector organisations who have specially trained counsellors. And the important thing is that you can access these without going through your GP. It's one of the very few things you can self-refer to in this country. You can read about these in the material we'll make available. And I would seriously, if you're feeling really down at the moment, anybody who's feeling like that, this is an accessible service. It's well established. It is available, admittedly online at the moment, but I would encourage you very strongly to consider that. If I move on to the next question, which is again a very good one that's come up, and it's come up from Angie. And Angie is raising the issue about having two kids. I have two kids aged 11 and 13. I've noticed they're struggling with the normal routine. Without the normal routine of school, weekend activities like football, meeting up with their friends. They constantly argue with each other. The youngest is not sleeping well. How can I help them to keep positive and ensure that they are happy and not getting so angry and distressed as they have been? And Angie, I'm sure a lot of parents would sympathize with you about this. The whole issue of having children at school for long periods, children not at school for long periods of time and not able to take part in the things. It's difficult for all of us having our routine disrupted. It's even more difficult for children and young people. Coming back to the principles of what might help, if you're able to reintroduce a routine that works for them. I don't know if you're being required to do homeschooling. Sorry for if you are, because I don't think that's a very straightforward thing for most parents. It's hard enough just to look after your kids, let alone to try and be the teacher as well. But if you can structure something and start again with the fact that what is it that could help them? Each of them, I mean, your children are close in age, but that doesn't mean they're close in personality or they will not have differences. So I think it'd be good to work with each of them. What are the things that they really enjoy? What are the things that they maybe need to do because of school? And have a sort of a semi-timetable where you can be with them and work through that. I also think it's important that that's individualized for them. All children, even when they get on perfectly well, and brothers and sisters and don't always go on perfectly well, and particularly if they're both feeling sort of a bit under pressure. I think the other thing is to have time when you can talk to them, and let more importantly, let them talk to you about how they feel. It's very hard sometimes to know what children make of things, and it's important that we create the conditions where they can say things that they maybe don't feel comfortable about, maybe something they heard on television or a worry they've got. We're all different, and children are different too. So some children can say that straight out. That's fairly unusual. But maybe if you're spending time with them doing something and just chatting as you're going along, or even if you're able to go out while you're walking or in the car, because we don't know how children are processing this. What we do know, definitely, is that large numbers of children are very troubled by this and are struggling. And again, we have got access and will make available access to things that you can do with your children at this time that help their emotional needs. Another thing I'd like to emphasize though, Angie, is that if you remember the gas mask thing or the oxygen mask thing on the airlines, you encourages you to put on your own before you do things for others. It's a good message to hold on to in life, because unless we look after ourselves, it can be very difficult to ensure that we are able to support them. So although their needs are very important to you, you to be able to meet their needs or try and help them meet their needs, need to give yourself some space. And that's an important role model for them in the future, that having a bit of time, mum having a bit of time on her own, or mum and dad having some time, can be a very big thing that they need to understand, because that's how we all support each other in a family. So very challenging, I think, and I'm glad you raised the question, because I think lots of parents, I know friends who are finding it really difficult at the moment, and where their kids who normally get on okay are not. It just seems totally exhausting. So please think of yourself. Think you're doing the right thing for them. And children are actually fairly resilient. If they know they're loved, a lot of things they'll get through in a way that maybe we suspect they won't. Move on to another one, which is coming in from Sam. Sam says, I have dilated cardiomyopathy, atrial fibrillation, and anxiety. My anxiety has been made worse since the pandemic started, and I start worrying about my heart, and that causes me palpitations, and I'm start worrying about whether it's my heart or whether it's my anxiety. How can I tell the difference? Well, that is really a tricky one, because many of the symptoms we have, the physical symptoms that come about from our cardiomyopathy, like palpitations, can also be induced by anxiety. Now, clearly, if you are having regular palpitations or any other heart symptoms, that's important, and you need to check it out. And if you're not sure, please speak to one of our nurses who are on each day. However, it is likely at this time, if you are anxious, that it could be. One way of doing this is, it sounds a bit simplistic, but it's if you have the acronym ABC, try and make a note and see if we can identify a pattern in what's happening. If we try and note down shortly after we've experienced this, what were the antecedents? What was I doing? What was happening when I started to feel like this? Was I talking to somebody? Was I looking at something on the television? Was I read something in a newspaper? That, I think, is really quite a common way of finding. And then if we see common elements, if, however, you weren't doing anything in particular, or maybe you were doing something physical and you suddenly got these, you'd start to think, that's maybe something that is maybe more to be worried about. If you actually also put down what's going on, the behavior, and that's not just what you're doing, but what you're thinking, what you're feeling. If you jot these things down, again, it can give you some insights as to where this is maybe coming more from your anxiety or more from an underlying physical condition. And the C is for consequences. What happened afterwards? How did I feel? What did I do? Again, you're looking for a pattern. And if you've put that down, and even if you can't make sense of it yourself, it's actually very useful to share with your doctor or with a nurse or whoever you're speaking with, because they might be able to see something in there and help you understand what's happening. But I think, again, a lot of us, I know myself, I occasionally have, it's not so much palpitations these days, I have a AF, but I've been treated for it. But I feel not quite right. One thing I have done, and this is on my cardiologist's advice, and this again wouldn't be for everybody, but I've now got an app on my phone and a little bit of equipment that allows me to, it's called Cardia with K. It allows me to take a basic, very simple heart reading. And what it does is tell you your heart rate, which lots of things do, but this also tells you whether there's anything unusual or potentially abnormal in the heart. And although it's nothing like as sophisticated as the ECGs we get when we go to the cardiologist or to the GP, it is actually quite reassuring, because there are times I've thought, I'm not feeling too good. I wonder if maybe I'm going back into a bit of AF, and I check it out and I'm reassured. And very often then I can think, no, it's probably because I didn't sleep very well, or because I've been rushing or whatever. They do cost money. They're not ludicrously expensive, so not everybody would want them, and a lot of people would find that they just actually make them be more anxious. So again, it's about choice. It's about what works for each of us, and we are all different. Another very useful one has been raised by Steve, which is Steve is somebody who has got obsessional compulsive disorder. It's also known as OCD. And Steve says, my OCD has got worse since the pandemic started. I have HOCM, hypertrophic cardiomyopathy, but it's the OCD that causes me more trouble. I'm constantly washing my hands, something I did lots before as a compulsion, but I was with CBT, with cognitive behavior therapy, which is one of the things I mentioned before, getting under control. I'm now becoming too fearful to touch anything without gloves, which I have to keep changing. I've called my GP, but I don't think she takes it seriously, even though I have a diagnosis of OCD and take antidepressants. Any advice on how to get some help? It's seriously getting me down. Well, it's very something. Obsessive compulsive disorder is a really tough problem to have. It's essentially, it is, we get where you get very intrusive thoughts, thoughts which you may know logically are not accurate about that something will happen, somebody might die or somebody become very ill, unless you engage in a particular compulsive behavior. And in some cases, and it sounds like this is the case with Steve, it has elements of concerns about contamination and then the need to wash yourself and clean very thoroughly in a way that is way beyond what most of us would think possible, and indeed can end up really harming us. Now, that's a hard condition to have, and it's even harder when we're being told every day, many times a day on adverts, and every time we get somebody from the government that we must wash our hands, and fortunately they've stopped telling us to sing happy birthday, which never really caught on for me. But it is important, obviously, that we are very careful, that we clean things, that we bring back in, we avoid these things. But there's a balance. And people at this time with obsessive compulsive disorder are experiencing a lot of problems. And Steve, there are specific materials there. I don't know if you're in touch with any of the organizations that support people with obsessive compulsive disorders, but they have quite a lot of them have put out materials that are particularly relevant for this. You refer to the fact that you were getting better with the support you got previously. Sounds as if you would benefit from getting back to that. I don't know if you can only access that through your GP, but if you think that she's not sympathetic, then I would consider contacting one of the talking therapy services that I mentioned earlier, the IAPT service. They may not be able to offer you support directly, but they may well be able to help you get access to help from other services in your area, which they'll be linked with. And again, the services are not currently available in direct one-to-one contact, but they are available online. And it sounds as if, given the effort you've already put into getting your OCD behaviors under more control, it would be well worthwhile getting support at the moment. And the fact that your GP doesn't seem to be particularly sympathetic or understanding of that is unfortunate, but I wouldn't let that put you off either trying to persuade her or approaching services directly via IAPT. And I wish you all the best on that. But there are, some of the other things that you will know about because you've already done them, if you can try reintroducing these. And the other thing that's very important, it's part of what we're doing this evening, and part of what I think is, it's sometimes so much easier to talk with people who've experience of the condition. So it's this peer support side of what we're doing. And that's true for cardiomyopathy, but it's very true for OCD. And I think talking to somebody else or other people who've experienced OCD or are living with it is something that's very valuable. And if it's something that you feel you can do, I would strongly encourage, particularly at a difficult time like this, when there will be many other people struggling. Moving on to the final question, which is from John. John says, is it not normal to want to go anywhere from my house? Or sorry, is it normal not to want to go anywhere from my house? I work from home and live with my partner. I haven't been out further than the garden in the last 4 weeks, as I'm too scared to catch the coronavirus. I've heart failure and have always enjoyed walking, but since the coronavirus hit, I am genuinely frightened in case I catch it and stay indoors all the time. Well, it is normal not to want to go out when we're being told constantly that there is a very dangerous virus out there. It is also, however, important that we get this into proportion. As I said earlier, most of us with cardiomyopathy do not come into the shielded category of the people who are at very serious risk. A small number do, and they must treat it very seriously and avoid contact. But most of us are able to work in the sort of just the social isolation, which means that we can still go out, and provided we follow the advice, we can go for walks, we can go and shop, we can go for medical appointments and other essential things. In your case, John, I think unless there are particular reasons that make you more vulnerable, it would be helpful for you to try and go out a little bit further with the support of your partner, if that makes it easier. And I'm not talking going far afield, I'm talking maybe just a walk around the block or to the end of the road even, or maybe just going out in the street, because that, I think, hopefully would help you check out what it is that is actually making you so anxious, and whether the concerns you have are actually proportionate to the risks that you face. We can pick up the virus easily, but in fact, it appears that it's only likely if you have fairly prolonged contact after over a number of minutes with somebody who is contagious, and that it is very unlikely that just walking past people in the street or even dealing with people in shops is going to do that. Yes, we've got to remain very careful. Yes, we've got to wash our hands carefully when we come back in, or wipe down things. But it is very possible at a time like this to just withdraw. And while that actually can make us feel more secure, I think it probably is something that could create more problems for the future. And again, if you do try this and you don't find that you can do it, I would seriously consider looking at the talking therapy services that might be available in your area, because this is at an early stage. It's something that could be very restricting on your life, but doesn't need to be. It's a very natural reaction to the pandemic, but the pandemic is not going to last forever, be around a lot longer than most of us would want. But we will have to prepare for a life beyond the coronavirus. And it's important that we manage to not break up things that actually matter, like being able to go out and do other things. Tough when you're working from home, tough when you don't need to go out, but maybe think, well, what do I want to do in the future? And do I want to restrict myself because I am genuinely and understandably anxious? If I can face some of these anxieties and look at different ways of tackling them, I would suggest that it would be a good thing to consider. I don't underestimate how difficult it is. And again, as with so many of the other questions, I think it highlights something that many of us will understand and experience. Anyway, that's been an interesting discussion, I hope, for some of you, and highlighted some of the issues. I would like to emphasize that it is incredibly difficult living with cardiomyopathy and coping with all the constraints of the system that we've got at the moment. I think we need to recognize and show a bit of compassion to ourselves, not beat ourselves up because of what we can't do, but be grateful for what we can, and look to support from the resources that are available. Obviously, from Cardiomyopathy UK, there will be other opportunities to talk about issues like this. There's quite a lot of gets covered on the normal Facebook. It's certainly something that our nurses and we have got experienced peer support workers who can also offer support for people on these issues. So do please try and be compassionate about yourself. I have a phrase that I've often used, because when I was working clinically, most of the people I saw gave themselves quite a hard time. And I always think that if we can start, we've got a hard time anyway, so let's not beat ourselves up about it. And it's a simple phrase, a change in a very well-known phrase, which is, I would say, do unto yourself as you would do unto others. Most of us are actually much kinder, much more thoughtful about other people's needs. This is a time when we need to think about our own needs, and how we can collectively, as a community, support each other and support each other to access specialist services as and when we need it. Anyway, I'm going to say goodnight on that. Stay safe, take care, and we will be putting up more information and that you'll all be able to access it. And the fact that you've raised these questions means that all other people who are part of Cardiomyopathy UK will be able to get that additional information too. I hope this has been helpful. Good night.